Zika, what do we know? Welcome to Health in the Heartland. My guest is Sandy Blair, registered nurse with Hardin Memorial Health. Thank you for being here, Sandy.
It's my pleasure. Thank you for having me.
What is Zika?
Zika is a virus that is spread through the bite of a mosquito. The interesting thing is that once you have had Zika virus, it's kind of like chickenpox. You can't have it again, so you build an immunity to it.
So what are the signs and symptoms that someone should be looking for?
Once it's been determined that you have Zika virus, it's actually a lot like other viruses. You'll experience fever, a rash, a lot of joint pain is very common that people are complaining of, and conjunctivitis, or your eyes are reddened. The symptoms are normally they're pretty mild and they last about a week.
So some people may not even know that they actually have the virus, is that correct?
That's a very good possibility, but when you couple that with travel or being associated with someone who has traveled in a highly infected area, then you should be very suspicious.
Now, there are certain precautions for individuals to be watching out for, and one of those is we're hearing pregnancy. Tell us a little bit more about that concern.
Pregnancy and Zika virus are a very bad mixture. What can happen is that if a pregnant mother is bitten by an infected mosquito and develops Zika virus, that can be passed to the fetus. And what that can mean for the baby is a condition called microcephaly, which it's where the head of the child is much smaller than it should be. And the problem with that is that the brain typically is as well. And so that child can have very serious learning disabilities. And microcephaly, unfortunately, is not the only severe birth defect that can be caused by Zika virus.
So if someone was to be pregnant during the summer months, or actually any time, pretty much right now, as we're talking about the Zika a little bit more in our society right now, they need to talk to their physician and make sure that they're using the precautions that they would need to. So how is Zika actually transmitted?
So it's transmitted through the bites from an infected mosquito. These mosquitoes are also the same mosquitoes that can spread dengue fever as well as chikungunya virus. So when you're tested for the Zika virus, you're also tested for these other viruses as well to determine exactly what you have. It can be transmitted from mother to child. A new thing that has been learned from the Zika virus regarding transmission is that it can be transmitted through sexual contact, and that's all sexual contact. You can also acquire it through blood transfusion.
So Sandy, how is Zika actually transmitted?
It's transmitted a few different ways. Of course, as we've already discussed, it's transmitted through the bite of an infected mosquito. But it also is transmitted from mother to fetus. And it's transmitted through sexual contact, which is something new that they've discovered, and that's through all sexual contact. Also, you can acquire it through blood transfusion.
So for more information on Zika, we encourage you to go to the CDC website, which is cdc.gov or hmh.net. This has been Health on the Heartland.